Hi, everybody. Hello. We're continuing on with motivational interviewing. And in this section, we're going to look at focusing the conversation. So if we go back to kind of our four processes, we've been talking about engaging. Now, you know that the engaging phase is kind of over with when you start to get sort of signals from the client that they feel understood. So they start to say things like yeah and exactly and you've got it, and so you get this feedback from the client that you're on track and that you've heard it correctly. And when you do your summaries, you get that kind of nod and verbal and nonverbal feedback that you're on track. But from there, we want to start focusing the conversation. So the engaging process has taken a very sort of wide view of what the issues are for the clients, their experiences, and what's going on. But we need to kind of narrow that down. Now, I have a picture here of some quail footprints. We have quail in our yard. And this is from last winter when they were kind of running around our driveway, and so I took some pictures of them in the snow. And they're quite the funny bird. And one of the things they do is they have this sort of randomness to how they move around. And in clinical conversations, there's a certain randomness to how the conversation goes as well. But we want to give the conversation direction so that we're not just kind of going from pillar to post, covering this and that and moving from one thing to another. And we do that by giving the conversation focus, or in other models, we talk about setting a goal, establishing a goal. Motivational interviewing has a kind of a broader view of kind of goal setting than other models, because remember, we're working with clients who are ambivalent about change. And so we're not, establishing a goal, stop drinking. But the focus of the conversation may be about drinking. So we want to be a little bit more open-ended on the focus of the conversation than sort of a SMART goal, for example. But we also want to be efficient in our use of time, both for the sake of the client. Clients, I think, feel better when they end the conversation that we got somewhere, and also in terms of your organizational needs. So focusing is the process of finding one or more specific goals or intended outcomes that provide direction for the consultation. Now, of course, one of the key aspects of giving focus is to be clear about what your role is within the organization and with that client. And that includes kind of what your expertise is. So you want to be upfront about that. If you haven't clarified that already, at this point in the conversation, you want to do that. Now, we can look at focus kind of along a continuum. So sometimes the focus is really clear and apparent. Client comes in, says, I want to, get some help with my drinking. And so it's clear and the focus is apparent. Other times there's multiple options and we need to kind of narrow it down. And other times the focus isn't clear. There's a lot of things going on for the client. And so this phase of the conversation is, takes more effort. We want to be careful in motivational interviewing. We don't just want to ask, what's your goal, and then the client answers and then whisk off from that. We want to be able to, we want to kind of explore it deeply enough so that there is clarity to what the goal is. Now, in motivational interviewing, we use kind of a concept of agenda mapping, which is really about kind of laying out what are all the different things that we've talked about in the engagement phase that we've identified that can be potential focuses for the conversation. So one way to do this is we've kind of finished off the engagement. We feel we've connected with the client. The client's kind of communicated back to us that we're on track. And so I'm wondering if we could take a step back and take stock of what's most important to focus on. I've been making a list in my head of concerns you've raised and want to check it out with you. All right, so we've been mentally making a note of the key topics, and we want to kind of narrow it down. Another way, I'm wondering where to go next. Of all the things that we've talked about, what should we focus on as the most important? And so at this point, you can kind of say, okay, so we've talked about kind of issues with, issues with your wife. We've talked about the amount that you're drinking and some of your concerns with that. We've talked about problems that you're having at work. Is there a particular focus that you would like to, follow up as we continue on in this conversation? Now, one of the tools that can be useful is what MI calls bubble sheets. And so this is just a piece of paper with a bunch of circles in it. And what you do is you write down in the circles the different things that you've talked about in the conversation. And so you'll write those down, or maybe have the client write them down. And then you ask the question, is there anything else? And then you use the bubble sheet as kind of a choice point. Some clinicians will create a bubble sheet. Often clients will have very similar themes, kind of where they work, and so create a bubble sheet that they have in their desk drawer, and then kind of pull it out at this point and say, okay, we've talked about a bunch of different things. Here are common kind of areas of concern. Do you want to kind of focus on this? And so it just helps give kind of direction to the decision making about the focus. Now, one of the problems with this idea of focus is what happens if the client hasn't brought something up. What if there's kind of the elephant in the room, or there's kind of a difficult kind of topic to talk about? How do you bring that up? And so, obviously one of the simple ways is just ask permission to talk about it. Would it be okay to talk about your drinking, and if it is related to your stomach troubles, can I add it to the bubble sheet? And so you can kind of do that. If something isn't sort of being brought up, even though it's kind of obvious that it's there, that elephant in the room, so to speak. Another way of bringing up difficult topics is kind of the use of kind of assessment information. So usually most clinical work involves some kind of assessment. And so this might be a point to say, either do the assessment if you haven't already, and if you have done it. So based on our assessment, we came up that, it looks like you have some, obsessive compulsive traits. Is that something we should kind of be talking about? One of the things that, MI has often done in the addiction world is to use formalized assessment. I think there's kind of what they call a drinker's checkup. It's an online test that you can do, and then it kind of scores you and kind of rates your drinking patterns. Is that high risk drinking or not? And so sometimes you can kind of do a test, and kind of this objective sort of measure takes the clinician out of the judgment picture. You're not looking like you're judging the person. You're just saying, okay, well, compared to other people. And so, based on the scores in this test, your level of drinking is in the top 10% of the population. How do these results fit for you? So you always want to do that kind of check-in, elicit from the client, how does it match for you? And so sometimes those kinds of things can bring in some kind of, get those difficult topics into the conversation. Now, sometimes it's just, it's just important for you to say something. In MI, this is kind of a last choice. But sometimes there's an issue that's very present there. You're concerned about the risk element, and so we don't, it would be unethical not to say something at this point. And so so if you're kind of at that kind of the last kind of ditch effort, you want to bring it up, but you want to do it in a way that's respectful and respects autonomy. Because one of your goals in these difficult situations is you want to keep the door open. You don't want to do, the big confrontation kind of thing. Excuse me here. And have the client never come back. So you want to do it in a respectful way. So kind of the kind of formula, if you want, or the structure that MI suggests is, making a direct statement about your concerns without making any kind of judgment. I'm concerned about, right? And then make a statement about the client's responsibility for choice or change. Or this is where we affirm their autonomy. You're in the driver's seat, right? On this, it's up to you, kind of what you're going to do about that. And then the final thing is eliciting the client's view. So what do you think about this? So keeping the conversation by having the client give you some feedback on your concern. So I have an example here. I'm concerned about your decision to hang out with your old friends. My concern is that this puts you at risk for using and getting high. You've told me that you want to be a good mother to your children and that parenting is harder when you're high. Of course, it's you who will decide about this. What do you think about these concerns? Right. So so in this example, you have a fairly matter-of-fact statement about the concern. My concern is about your decision to keep hanging out with your old friends because they're using and you've told me that you don't want to be getting high because it impacts your parenting. But I recognize, of course, it's up to you who will decide about this. But what do you think about these concerns, right? And so it keeps the conversation open, it keeps the conversation going, but you're also doing what you need to do as a clinician to state kind of your concerns there. Okay, I'm going to move on to sort of another piece of kind of the focusing, because sometimes at this point we have to, not have to, but information exchange is important. My background is in healthcare, and healthcare does a lot of information giving to patients and clients. And MI asks us to kind of take a pause and just kind of think about this process. What we want to be doing is giving information to clients that's useful to them. I always felt bad for our dietitians because clients would come in with newly diagnosed diabetes. The dietitian would give them all this information about being on a good diet, healthy lifestyle choices, etc. Client would come back 2 weeks later and not have done anything with it. And so of course it's very frustrating for a clinician to always be giving out information and not have clients kind of respond to it. But part of the problem is twofold. One is clients may already know the information and we're kind of engaging in kind of wasted effort. But also information can be overwhelming for clients. And so just being blasted with a bunch of information doesn't necessarily help facilitate change. Helps us feel like we're being responsible, professionally, but it isn't necessarily that effective. And so in motivational interviewing, they use a process they call the EPE sequence. Elicit, provide, elicit. So in elicit, we're kind of using kind of the solution-focused thing about what do you know about this? So what do you already know? What information do you have? What experience do you have? And so we're eliciting from the client their expertise, their knowledge in a particular area. And then we ask permission and offer our expertise. Okay, if you're okay, I'd like to share with you some things that we found to be helpful. And then elicit. Check out the client's response to that information. So what do you think about that? How does that fit for you? Because we're really wanting information to fit for the client, to match the client's kind of needs. So here, I've got an example here. So elicit. As you've struggled with this problem, tell me what you have learned about what can help. So I think I'm kind of imagining kind of a situation with a client who's struggling with depression. So tell me, what have you found that helps you with struggling with depression? So pulling out the client's expertise. Would it be okay if I share with you some things that we've found to be helpful? And I always kind of like kind of pulling in kind of the clinic or the kind of the expertise of the clinic, but you can certainly use, I have found to be helpful. So you ask for permission, presumably the client says yes. Several of our depressed clients use the 5-minute rule. They set a goal of doing something for just 5 minutes rather than attempting to complete the whole task. This makes the goal seem more manageable, helps them get started, and takes the pressure off of getting everything done. So one of the issues with depression is just getting people started on doing something because the tasks seem overwhelming. So this 5-minute rule is kind of a useful thing. And then we elicit. What do you think of this? Would this be helpful for you? Right. So again, kind of, we're eliciting the client's expertise, we're asking permission, and then offering our expertise, and then getting their feedback on it. So again, very much with this concept of a collaborative relationship. The client has an expertise. I don't need to repeat what they already know, and then I can offer my expertise with permission. And what do you think? So just on that, the thing about permission, in motivational interviewing, we like to ask permission when we're giving information. MI doesn't make that sort of mandatory, but if you're going to give advice, when you say, I think I have something I think you should try, that we would always ask permission then. So when we're giving advice, we always want to ask for permission. And make sure that that's okay. So we don't want to be giving unsolicited advice, because that's that can kind of take us down a darker rabbit hole. Okay, all right. Well, that ends that piece on focusing. Take care.